Lakeasha Sullivan is a clinical psychologist. She joins me now from here in Atlanta, Georgia. She is also one of the healthcare professionals that the New York Times, it took part in the New York Times Psychology Today survey. Thanks so much for being with us. It was interesting. One of your replies to the survey quotes you saying, and I'll just read it for people, "I regularly wished aloud for a mental health version of Dr. Fauci to give daily briefings." Has enough attention, nearly enough attention, been paid to this aspect of the pandemic, the mental health aspect?
Absolutely not, Michael. At the very beginning of the pandemic, I could see clear trends in terms of emotional functioning, among my patient population. And it was unfortunate that I wish they could talk to one another because at the beginning of the week, there was a theme as if like anger for the week or depression or people were sad and people were exhausted. And they felt so isolated. And so, at the beginning, I really truly wished that there was like a forecast of some sort to let people know, basic emotional like processes like depression often follows anger and things of that nature to almost get yourself ready. If you're feeling
Yeah.
this, then this may come next. And so,
Preparation, yeah. No,
yeah,
I can understand that. One of the worrying aspects, and there are many, of this survey is that nearly 1 in 3 clinicians said it could take at least 3 months to get an appointment, or they didn't have room for any new patients at all. Have you seen that level of demand?
absolutely. Everyone I know in my network is either at capacity or near capacity. And so, it's really unfortunate. And, my take on it is that, in the short term, of course, we need more clinicians and we need more mental health services and to have people be able to access those mental health services in affordable ways. But the long-term solution, I believe, is not necessarily more clinicians. It's really focusing on teaching people, students would be the great, children on up, basic um, emotional information about emotions.
Mm,
Um,
yeah.
so, so people know what emotion, like, so people can normalize emotions for themselves.
Right.
And so, yeah.
As I was reading the study, the survey, it struck me how are therapists coping? Because you all seem to be under it. I mean, you got the workload, the sort of things you're hearing. Who counsels a therapist?
Right. Well, most therapists are in therapy, or they have had a robust therapy in the past. And so that's a major source of support for therapists. We also have consultation groups we're part of. And therapists are notorious for saying yes to requests. And so therapists have to, I think this pandemic really highlighted the need to set boundaries and to engage in self-care and to be, to basically try to protect our careers and ourselves from burnout.
Right.
Uh, and
What would be your advice for someone who's watching right now, perhaps feeling overwhelmed, depressed or whatever, and can't get in to see someone like you? I mean, what would you say to them?
Right. Well, I would say that, so barring really significant symptoms that indicate serious mental illnesses like that needs, if someone is experiencing that, they need attention and they should go, to their primary care doctor or urgent care or something like that. Barring that kind of situation, I would say that it would be very useful if people don't pathologize themselves, that they allow themselves to feel grief and to feel anxious and to feel angry and to feel all of those things, as opposed to engaging in behaviors or mental behaviors even that suppress those emotions because it just makes it worse.
I wanted to ask you this too. I mean, has at least discussion of mental health because of the pandemic at least had the benefit of perhaps destigmatizing the issue a little?
Absolutely. Most of my patients are first timers,
Right.
and it's a really wonderful thing. And so, the phones are ringing off the hook So yes.
And also, are you treating people who you may not have seen if not for the pandemic? I guess, has the pandemic exposed underlying issues for people, magnified them, brought them to the surface, relationships, too much of the kids and so on?
Absolutely. So one way to think about the symptoms that people have is that it's called the diathesis stress model. Now I won't really get into it too much, but basically that someone could be predisposed to a condition and faced with a certain environmental stressor, that condition may manifest. And so I do believe that some people, because of the stress of the pandemic, are now manifesting issues that they were predisposed to manifest. And so that is a subset. But I also believe that there are a lot of people who, one, they pathologize their own emotions, normal emotions that humans experience under unnatural and stressful and traumatic situations. So they may be pathologizing themselves. So then they're coming to therapy for these reasons. And so for that group of people, I don't necessarily think they would have sought therapy. But then again, it's a biased sample. People who seek help are people who tend to seek help when they reach a certain point.
Such an important issue needs to be talked about. And thanks for the work you do. Clinical psychologist Lakeasha Sullivan, thanks so much.
Thank you so much, Michael.